Hi, friends. Today I'm going to talk everything you need to know about breakfast. For the ease of your understanding, I will divide this topic in two parts. In part 1, I will talk about who all should not have breakfast, meaning what subset of people should skip breakfast. Here I will also explain the concept of intermittent fasting and its benefit. In part 2, I will talk about what subset of people who should always eat breakfast and avoid skipping it. I will also explain what exactly is a good breakfast versus a bad breakfast. All our lives we have heard that breakfast is the most important meal of the day. A study from none other than Harvard University stated that men who regularly skip breakfast have a 27% higher risk of suffering a heart attack and strokes. But now we know there's no proof that skipping breakfast causes heart attacks or any other problem. That Harvard study? The authors actually concluded it remains unknown whether specific eating habits influence heart disease risk. There's no proof that skipping breakfast is harmful in any way. That strokes and heart attack news persists because people who skip breakfast have more health problems. But that's partly because breakfast skippers are more likely to smoke and eat unhealthy foods. There is just no proof that skipping breakfast itself causes problems. Another myth about breakfast is that skipping it may make you fat. Few scientists claimed that just 9 years ago, saying not eating breakfast has been associated with excess body weight. But that's not true either. According to a new analysis, they looked on a number of different studies, and they did not find this to be true, partly because eating habits are hard to study. You can't follow test subjects for years controlling what they eat. Most studies are based on what people say they ate, and people forget or lie. Let's first talk about some statistics. We know 2/3 of women 30, 50 years of age are overweight, and more than half are obese. How do we proactively address this statistic without quick fixes? Women in their 40s to 60s gain an average of 1.5 pounds per year. Some of this is attributable to things like hormonal fluctuations, women having less lean muscle mass than their male counterparts, sleep disturbances, and mood disorders. However, there are strategies we can use to help offset this. So folks, I want you to save your money on potions and powders and supplements that are not long-term solutions. I've got a better idea, and I'm going to tell you about it. There are lots of strategies that I use with my female patients, but none more powerful than intermittent fasting. Yes, intermittent fasting is that magic bullet that can allow you to gain back your former selves. Really powerful. And the really cool thing about intermittent fasting is it's free, it's flexible, and it's simple. It takes nothing else away. Free, flexible, simple. Before we begin, what exactly is intermittent fasting? Intermittent fasting, is an eating pattern that cycles between periods of eating and voluntary fasting. And the typical time frame that I recommend to my female patients is a 16-8. 16 hours a day fasted with an 8-hour feeding window. I know that seems a little overwhelming at first, but I'll give you some strategies for how you go about doing that. So who all can skip breakfast, meaning to say, who all can actually benefit from intermittent fasting? Number 1, people with obesity and hypercholesterolemia, wanting to lose weight, especially visceral fat around our abdomens, around our major organs. Studies have shown that intermittent fasting can provide 20–40% reduction in calories, which means that you can fuel fat loss, improve insulin resistance, and lower blood sugar levels. Number 2, people seeking to improve brain health, as intermittent fasting can enhance memory, improves mental clarity because it lowers insulin levels, improves learning by promoting the growth of new nerve cells and protecting against degenerative brain diseases like Alzheimer's. It also spikes human growth hormone, which helps us with lean muscle mass. It induces something called autophagy, which in simple terms means spring cleaning for the cells. This autophagy is only evoked when we are fasted. Number 3, people wanting to reduce inflammation in their body. Intermittent fasting may decrease markers of inflammation, which is a key driver of many chronic diseases. One of the most important distinctions when it comes to how frequently we're eating is the debate over sugar burners versus fat burners. A sugar burner is someone that consumes lots of carbohydrates and taps into glucose as their primary fuel source, which is incredibly inefficient. If you recognize these individuals, They are frequently hungry and have significant dips in their energy level. Their insulin levels are high. Insulin is the fat-storing hormone. So if levels remain high, we have more oxidative stress, we have more inflammation, and we struggle more with weight gain. In sharp contrast to this are fat burners. They tap into fat stores for energy. They have sustained energy. They are much more clear cognitively. They don't get hungry. It's easier for them to lose weight because they tap into those fat stores. They sleep better, and they age more slowly. So meal timing and how frequently we are eating, it's absolutely crucial. Who all should avoid intermittent fasting strategy. If you are a diabetic, especially if you have a difficult to control diabetes, if you are a child, an adolescent, or your age is greater than 70, this might not be the best strategy. If you are pregnant, if you have chronic heart issues, kidney or renal issues, not the best strategy. If you have a history of a disordered relationship with food, whether it is anorexia, bulimia, or binge eating, might not be the best strategy. And last but not least, if you have a low body mass index, you're frail, or you've recently been in the hospital. Next, let us all understand clearly as to when you're ready to eat. What do you eat? There are foods that are going to be more advantageous for you to consume when you're ready to break your fast. So I want you to focus on real whole foods. That's what your body needs, wants, and deserves. So I want you to purchase the best quality protein that your budget permits. Ideally, organic meat, wild-caught fish. Healthy fats, so crucial and helpful for building healthy hormones and also really important for satiety. Making sure our taste buds light up, make us happy. Also, focus on things like avocados, coconut oil, nuts. Really great, healthy fats. Unprocessed carbohydrates, absolutely crucial. Low glycemic berries, green leafy vegetables, squash, quinoa, sweet potatoes as opposed to bread and pasta. And lastly, keep yourself well hydrated. Now, I want to make sure that I briefly touch on some of the practical implications for how you would go about starting intermittent fasting. Generally, start with 13 hours of fasted period, and then slowly increase by an hour or so until you've reached that 16-hour mark. In addition to that, you want to ensure that you give it a solid 30 days before you determine if it's the right strategy for you. It may take 6 to 8 weeks to really see the full benefits of what you're doing, so have patience and give this strategy a try to experience the benefits on your own. If you like this video, I request you to like, share, and subscribe for more health content. See you in the next video where I am going to discuss in details about who all should have breakfast and what exactly is a good or bad breakfast. Until then, take care and stay healthy. Recap. Who may benefit? 1. Weight, visceral fat loss. 2. Brain health. 3. Reduce inflammation. Who should avoid? Diabetes with poor control, pregnancy, children elderly over 70, kidney heart issues, eating disorder history, low BMI or frailty. When breaking fast, focus on quality protein, healthy fats, unprocessed low glycemic carbohydrates, and hydration. Step 1. Start slow, 12 to 13 hours, then add an hour every few days. Step 2. Prioritize protein and healthy fats at first meal to stay satisfied. Step 3. Hydrate and sleep well. Good breakfast example, eggs with vegetables and avocado. Bad breakfast example, sugary cereal and fruit juice. Greek yogurt with berries and nuts is a good option. Avoid refined carbohydrates like white bread, pastries, and sweetened drinks. Choose unprocessed carbs, sweet potatoes, quinoa, whole fruits like berries. Include healthy fats, avocado, olive oil, nuts, for satiety. Meal prep helps you stay on track. Plan your feeding window and meals ahead. Use simple tracking, not obsessive logging, but awareness of patterns. Be patient. Sustainable changes take time. What about exercise? You can exercise in the fasted state if you feel okay. Listen to your body. If you are on medications, especially diabetes meds, talk to your healthcare provider before trying. If you feel dizzy, faint, or experience concerning symptoms, stop and seek care. It lowers insulin spikes and may improve insulin sensitivity over time. Autophagy, cellular cleanup, happens during fasting windows and is one reason may benefit brain and metabolic health. But remember, Evidence evolves and individual results vary. Expect gradual change. Weight and metabolic gains happen over weeks to months. The goal is sustainable habits, not quick fixes. Focus on whole foods and consistent patterns. Key takeaways. 1. Skipping breakfast isn't inherently harmful. 2. It can help some people with weight, brain health, and inflammation. 3. Not for everyone, no contraindications. 4. Break fast with protein, healthy fats, low glycemic carbs. 5. Start slow and be patient. Consult your healthcare provider for personalized advice. If you like this video, I request you to like, share, and subscribe for more health content. See you in the next video, where I'm going to discuss in details about who all should have breakfast and what exactly is a good or bad breakfast. Until then, take care and stay healthy.